My name is Captain Chad Greathouse with the Louisville Fire Department. Today we are going to do a class on BLS administration of intramuscular epinephrine. This will be a review as well as an upgrade from the December 2015 class of the same title. So what is anaphylaxis? That is what we will be administering epinephrine for. It is a severe allergic reaction, and your patient may exhibit several signs and symptoms. Some of them could be the patient has a rash or hives or experiencing some swelling. They may have stridor, which is that high-pitched crowing sound heard when they inhale. The patient may complain that their throat is tight or that they're having difficulty swallowing. They may complain of shortness of breath, so much so that they're having trouble even completing full sentences. When you auscultate their chest, you may hear wheezes, you may hear decreased breath sounds, or you may hear no breath sounds at all. The patient will also have a low blood pressure. Now, these signs and symptoms will appear typically within the first few minutes after the patient has made contact with the allergen, whatever that allergen may be. It may be an insect bite, it may be a sting, a certain type of food, or some types of medication. So, what is our general treatment for anaphylaxis? First of all, we'll give high-flow O2, either through a bag valve mask or a non-rebreather. If the patient is wheezing, we can go ahead and give our albuterol, and then we will assist or administer an EpiPen if the patient has been prescribed one. If they are not, then we can give them an injection of our epinephrine that has been issued to us, and as well as if the stinger is still present, we need to take a piece of hard plastic like a credit card or perhaps your driver's license and scrape that stinger away from their skin. A little bit about an epinephrine. It's a naturally occurring hormone within our bodies. It is released from the adrenal gland when we have that fight or flight response. Now, it has several effects and side effects on the body. First of all, it will open the airways. Those lower airways down in your lungs, those will dilate and they will open. Epinephrine will also cause an increase in blood sugar. There will be an increase in heart rate, in blood pressure, in O2 demands for the heart. The patient may state that their heart is fluttering or feels like it's beating out of their chest. They may complain of a headache. They may have that shaky or that nervous sensation. Your patient will be pale, sweaty, possibly nauseous, and even vomiting. Now, if we give epinephrine IM, then we should see these effects within 3 to 5 minutes, and they should last between 1 to 4 hours. Now, prior to us giving epinephrine, one thing we need to do is check the 6 R's of drug administration, and those are the right person, the right drug, the right dose, the right time, the right route, and the right documentation. First of all, the right person. Obviously, it'll be our patient, the individual who is having an allergic reaction or is experiencing anaphylaxis. Also, if we're going to be administering a prescribed EpiPen, then we need to make sure the name on the EpiPen matches the individual we're giving it to. Secondly, the right drug, in this case, will be epinephrine 1 to 1,000. The right dose is 0.3 milligrams for an adult, 0.15 milligrams for a child. Now, how can we tell the difference? If your patient is 8 years old or older, or they are heavier than about 60 pounds, then we are going to treat the individual as an adult. The right time refers to the expiration date, whether it be on our epinephrine or on the EpiPen that the patient has been described. We need to make sure that the drug has not expired. The right route and the right documentation we will discuss here momentarily. So, first thing we need to do is prep the medication. Now, our Epi comes in a glass vial, 1 milligram of epinephrine in 1 milliliter of solution. Now, this vial needs to be kept in a dark environment, and it needs to avoid temperature extremes until it's ready for use. The BSI for giving epinephrine is going to be eye protection as well as gloves. We are going to confirm the 6 R's, which I discussed in the last slide. And then one of the changes we are making is the use of a filtered needle. So I will talk about that here in just a second, okay? But we need to take a look at the medication itself to make sure it's clear. We need to make sure that there's nothing floating in it. We'll prep our syringe first with the filtered needle. Now the purpose of the filtered needle is this. When we break the glass vial, there is a possibility that glass shards will actually fall down into the medication. Now if we just draw that up with a standard needle and draw that up into our syringe and then inject the medication with the glass shards into a patient, now we can cause an infection. And obviously we don't want to do that. So the filtered needle's purpose is to filter out those glass shards. So we will prep that. First of all, we will put the filter needle on the syringe. Now the filter needles are going to be red in color, and they're not going to say filtered needle on the package. It's going to say like a blunt fill needle is what they will say. But I have it set up and we're ready to go here. In order to open the glass vial, we're going to wrap it with a 4x4. Okay, we have our BSI on, but we're going to turn our head, we're going to close our mouth, and we're going to break the top off of the glass vial, and then dispose of the top into our sharps container. Now all we are left with is the bottom portion of that glass vial. Take our syringe with our filter needle. We will withdraw the proper dose. Again, if it's an adult, it's going to be 0.3 milligrams. If it's a child, 0.15 milligrams. So we'll withdraw, let's say we're treating an adult, 0.3 milligrams. And then we will set the glass vial aside. Do not throw this away. Put it in a place where it's not going to be tipped over, or give it to one of your partners and let them hold on to it, because we may have to use it later. So we got that set aside. And then we will, after we have the medication in here, we need to withdraw the plunger a little bit more and get a little air bubble into the syringe. All right. So then we will cap the needle, and we will take the filter needle off, and we will properly dispose of that into the sharps container. Now we install our injection needle, and you can go ahead and remove that air bubble out of the syringe until we have nothing but medication in there, and then go ahead and recap your needle until we're ready to give the medication. Now what we need to do is prep our injection site. Now 2 sites that we can use is the shoulder or the deltoid muscle, as well as the side of the thigh, where we typically put in an EpiPen. The preferred method for this IM injection is going to be in the deltoid muscle in the shoulder. So you can see on the screen there, that green triangle, that's going to be our injection site into the shoulder. Now how we find that is, we find the patient's collarbone. Take about 2 finger widths and come down, and then we can make a V with our fingers, and inside that triangle is our injection site. So once we find that site, we will take an alcohol prep and clean the area. Do not blow on it to dry it faster. It will dry fast enough. With you blowing on it will contaminate the site, so don't do that. We'll take our syringe, take the cap off. We will pull the skin tight, and we will inject the needle into the muscle at a 90-degree angle. Before we inject the medication, we will actually withdraw the plunger. Now the reason we do that is we're looking for blood. If blood comes back into the syringe, then we have injected the needle into a vein or into an artery. So what you're going to do is you're going to pull the needle out, you're going to dispose of it into a sharps container, and you're going to have to start over. If there is no blood in the syringe, then you're going to go ahead and inject the medication, pull the needle straight out. You will dispose of your syringe and needle into the sharps container, and then you will place a Band-Aid over the injection site. Next thing we need to do is document our actions. First thing we need to document is the indications for giving the epinephrine to the patient, their signs and symptoms. That needs to be written down, as well as the dose, the route that we gave the epinephrine, and the time that we gave it. And then we need to document the positive and negative effects that the medication had on the patient. Now, per protocol, we are allowed to give a second dose of IM epinephrine if the patient needs it. But we have to do that with permission from medical control. The second dose can be given 5 to 10 minutes after the first administration. So we will need to draw up another 0.3 if it's an adult or another 0.15 if it's a child out of our vial with a new syringe, a new filter needle, and then using a new injection needle. Now you may use the same muscle. If you're going to use the same muscle, so let's say I use the patient's right arm, right shoulder, then I need to move away from the initial injection site about an inch. But another option is obviously to move to another muscle. You can pick the other deltoid muscle, the patient's other shoulder. But as I said, before we can give the second dose, we have to get permission from medical control. So how are we going to do that? On Fire 1, what you're going to do is tell MetroSafe that you need to talk to U of L or Children's, obviously depending on the age of the patient. Then MetroSafe will tell you to go to Hospital 1 or Hospital 2. Now you see on the slide the areas highlighted. You see Hospital 1 there, the picture of the radio screen, the upper left-hand corner, and you see the B highlighted. So on our radios, we need to go to Zone B, Channel 10. That is Hospital 1. Hospital 2 is Zone B, Channel 11. Once you reach the appropriate channel, then the physician will come up and they will give their license number. You need to document that number. Then what you're going to do is you're going to state your rank, you're going to state your name, tell them you are with Louisville Fire, and then you will ask, how do you copy? They should respond with something like, you're loud and clear. And then what you're going to do is give your patient report. You need to give the age, the sex, the event and the time of the event, the chief complaint, signs and symptoms, any medical history that's applicable, vital signs, what treatment has already been administered, and how the patient has responded to that treatment. And then you're going to ask permission for what you want to do next. So I will give you an example of a call-in. This is Captain Chad Greathouse with the Louisville Fire Department. How do you copy? And they will respond, you're loud and clear. And I will say, I have a 46-year-old male that was stung by a bee about 30 minutes ago. He is allergic to bee stings. He complains of shortness of breath and throat tightening. He has systemic swelling and hives. His current heart rate is 120, blood pressure of 90/60, a respiratory rate of 30. We have already given one dose of 0.3 milligrams of epinephrine IM about 8 minutes ago. The patient has had some relief. I would like to go ahead with a second dose of 0.3 milligrams of epinephrine. And then what you're going to do is you're going to document the physician's response and then proceed with the treatment if permission was given. And then obviously you will document the patient's response to the second dose. Now, this is going to be a rare event where we're actually going to have to call for this, and two things are going to have to happen. One, the patient is not responding well to the first dose of epinephrine, and secondly, the med unit is delayed. So it's probably going to be a pretty rare event, but you need to know how to call for medical control and get orders to do this just in case. So that is going to conclude our training. So what we covered today was what anaphylaxis is, as well as the signs and symptoms. We talked about the general treatment of anaphylaxis, what epinephrine actually is, as well as its effects and its side effects. We discussed the 6 R's of drug administration. We talked about prepping and administration of epinephrine. We looked at documentation, as well as looked at how to give a second dose if needed. Thank you very much.